everyone. My name is Evelyn, and I am an M2 here at the University of Michigan Medical School. Today, I will be talking about the challenges to professional interpreter use among surgical providers. My co-investigator is Paris Rollins, who is an M4 here, and our PI is Dr. Reddy. Dr. Reddy has no disclosures relevant to this work. So, limited English proficiency patients actually make up 9% of the US population, which ends up being 25 million people. Now, unfortunately, these populations have worse health outcomes than their English-speaking patients. And professional interpreters help address these health disparities. They are truly a critical role in ensuring that the patient understands and is able to take part of the medical decision-making, that they are able to obtain accurate informed consent, as well as understand things like their discharge paperwork, the side effects of the various medications they're taking, the long-term outcomes of the surgical procedures they are about to have. Now, unfortunately, interpreter access is only half the battle. So we conducted a survey for surgical faculty and residents at the University of Michigan because we wanted to get a better understanding of the estimated need of medical interpreters, as well as how often they're actually being used. And if there was some discrepancy between the need and use of medical interpreters, we wanted to get an understanding of the barriers to interpreter use. So we had 83 responses, 55% which were female, 59% were faculty, and 41% of our participants only spoke English. So we actually hypothesized that faculty would more consistently use interpreters. We also hypothesized that those who spoke more than just one language would also use interpreters more consistently. So our results demonstrated that our participants had an average of 16.33 encounters per year, and of our participants, 2/3 reported consistent interpreter usage. So what I mean by this is 2/3 use interpreters 100% of the time that they were needed. Now, if we look here at the interpreter use consistency, we see the amount of people who reported 100% use, and we also see the 1/3 that reported less than 100% and kind of how they were distributed. Now, what's even more telling is if we go to the 1/3 that reported inconsistent use, we see that they reported about 8 missed encounters per year, and actually faculty were more consistent than residents. So if we look here at this, at the residents graph, we see that residents had about 410 encounters with LEP patients, and for 161 of those, they did not use interpreters. Now, there was no difference based on language proficiency. Now, we asked our participants to rank the barriers to interpreter use from 1 to 5, and what we're looking here in this chart to the left is how many people ranked certain barriers as their number one reason. So if we look here, 30% ranked patient preference, as in the patient preferred to have a family or a friend translate instead, as their number one reason, and 29% listed time constraints. In other words, it took too long to get an interpreter as their number one reason. Now, if we look here to the right, we see the various reasons that were given, as well as how often they were ranked in the top 5. So if we look here, the wait time for an interpreter is too long. 80% of the participants ranked this in their top 5. About 60% ranked, I don't know how to arrange an interpreter, and also 60% ranked, patient prefers to use family or friend, all in their top 5. And here we can see the other reasons. Now, just to summarize a little bit of what I've said, so 1 in 3 providers underutilize interpreters, and they list time as a major constraint, as well as patient preferences. Now, we really have to think about what this means and the unintended effect that this can have on interpretation accuracy, as well as legality. And this has really significant clinical implications and ramifications for both patient comprehension, as well as provider liability. Because we need to ensure that what our patients are hearing is accurate medical information. And we also have to consider that if there are friends and family in the room interpreting, there might be things that the patient doesn't want to say in front of them, or maybe that the family member doesn't know how to translate or doesn't want to translate to them. Thank you for your time.